has shown that an estimated 250 million children under the age of 5 in low and middle income countries are at a higher risk of not reaching their full developmental potential. In this conference, Your Excellence, we will focus on children in diverse circumstances, including children in emergencies, those in refugee camps, those accompanying their mothers to prisons, and those in informal settlement, as well as those in the rural.
ECD is a relatively new area of work in many countries, which until recently did not enjoy the same level of knowledge and awareness and publicity as many other areas in public health. It is now that we are learning with experiences from many countries, and Kenya included, regarding the importance of nurturing care framework, the importance of early childhood development, and that is a time for all of us to come together and to make sure that we really prioritize those nurturing care framework investments in order to ensure that Kenyan children get the best in line with all of the international standards.
We trained and sensitized care leaders across the county and sons of early childhood development, apart from establishing an all-inclusive government-led early childhood development multi-sectoral coordinating committee. Our government also approved a policy entrenching ECD programs in government activities. To ensure sustainability of our efforts, we have anchored nurturing care for early childhood development in Siaya County Health Act 2020 and are currently drafting a nurturing care for early childhood development policy document to include the school feeding program.
Through the various nurturing care for early childhood development projects implemented by the county government of Siaya and its partners, we have moved the needle in making early years of a child's life a key social development agenda.
The foundations have been mentioned before: adequate health care and nutrition, opportunities to learn, protection from violence and abuse, as well as caregivers who respond to their needs with love and with stimulation. And the earlier the intervention, the better the outcomes for the child and future prosperity and sustainability of society as a whole.
At the national level also, we have also done the curriculum designs for pre-primary 1 and pre-primary 2. These designs have been developed in such a way that learning is expected to be enjoyable for these children. The aspect of teaching through play and the child-centered methods have been embedded in the design.
We want a situation where we can help all our children to transit from childhood to adolescence and to adulthood without a problem. And the solution is addressing the problem up the stream. And which up the stream am I talking about here? No, where it all begins. Nurturing care for early childhood development is the solution here. We have to nurture values, we have to nurture spirituality, and we have to nurture care.
The fifth category is what makes me to be here today. And these are children accompanying their mothers in prisons. These are children who are sometimes not seen by the judicial system. Why? Because they could be in the womb by the time the mother comes to us. So the children gets introduced along the way or when they are already with us. Meaning then that it is possible that they are not even budgeted for. Meaning then that it is possible that nobody really thinks about them because you don't see them. Because the mother works with this baby, the mother gets convicted and gets convicted with this baby.
We have to be intentional in our programming for children in emergency settings, especially as the Ministry of Health, because these children are unique and their needs are unique. Current estimates from this year have us at 21 deaths per 1,000 live births for the neonatal mortality. For the infant mortality at 32 deaths per 1,000 live births, and at 43 for the under 5.
Quality interactions between caregivers and CHVs was reduced. Contact time was reduced. Look at the context of CHV work. They visit a household. In our African setting, if you go to someone's household and you knock, they welcome you in. You're supposed to go in. But with COVID, the CHVs needed to interact with households from outside in an open environment. So first of all, they knock, they are told, please come in, and they say, no, we can't come in, you come out. That alone was not natural.
We have six sub-county education officers to oversee the supervision of ECD programs with one director.
We have done 224 classes. We also have ensured that we have established what you're calling feeder centers. These are in areas where we have densely populated urban centers, and also in the rural areas, especially where children were walking for distances of more than 2 kilometers to school.
We have a very good working environment with our partners in inclusive health approach. This was championed by UNICEF too, that made us have a friendly learning environment and also good connection with our health officers.
Community health strategies are in place to enhance ECDs. Multi-sectoral approach or model is what we are using to partner with our stakeholders.
Involve parents and communities in decision making. Engagement of high-level decision makers is key. Make it a win-win, working with county and national government. Social norms and culture can change through evidence-based continuous communication for change.
First of all, play should be made an integral part of any ECD delivery. Secondly, government should be leveraging on the existing practices and structures. Thirdly, government can scale up the project with the support of partners. Collaboration between Ministry of Health, Ministry of Education and other stakeholders can promote the integrated ECD services.
Hey.